It's now my pleasure to introduce Dr. Catherine Thomasson.
Thank you. That was really a really wonderful speech. I'm a physician. I was a primary care physician in Oregon for over 25 years. I care deeply about climate change and health and moved here to Washington, D.C., where I'm now the Executive Director of Physicians for Social Responsibility. When I was a primary care physician back in Oregon, though, I took care of families who were displaced by floods. Some were injured when they would arrive at the shelter. Many families were able to return home, but they had to clean up the walls, the mold, and the sewage. Some developed asthma from the mold. Some lost their health insurance because they couldn't afford to buy health insurance and take care of their home. They mourned the loss of their pictures, their special mementos, and I treated their depression from living through a disaster and helped them with their anxiety the next time the flood season came through in the spring. In Columbia County, Oregon, flooding occurs every year now, when it didn't used to. So climate change is real. It's impacting us now, and we're seeing the health impacts of that already. As we all know, Hurricane Katrina was one of the worst disasters here in the United States. Over 2,000 people died, and 1.5 million people were displaced from their homes. That is just a huge number. The hardest hit state, Louisiana, only 72% of people were actually able to return to their address. So that really impacts health and impacts people's ability to move on with their life. More people in that region of New Orleans, in particular, have much higher usage of Medicaid, meaning that they are below the poverty level now. According to the Federal Emergency Management Agency, or FEMA, as we heard from the mayor, between 2005 and 2015, there have been over 93 weather and wildfire disasters costing over $1 billion. The grand total is $586 billion of damage over 10 years. Now, FEMA provided grants of $67 billion, or 11% of the damage. So that means that a lot of homes and businesses and a lot of people's health have been damaged by these weather disasters. We heard about ground level ozone causing new cases of asthma and impacting our newborns with lower fetal birth weight, and the particulate matter from not just coal burning power plants, but from the wildfires in the West, causing unchecked amounts of particulate pollution that we can't do anything about until it settles out. And it leads to the 4 out of 5 of the leading causes of death in the United States: heart attacks, strokes, lung exacerbation, and cancer. Lyme disease, as those of you here on the East Coast know, is epidemic, but it's now epidemic in Wisconsin, where it was too cold for the tick-borne vector to last through the winter. Worldwide, climate change is killing 400,000 people a year, climate change. And that's primarily due to malnutrition and hunger, as well as infectious diseases from the lack of safe, clean drinking water. That's why I'm here today. Supporting the Clean Power Plan is a health imperative. It's an essential program to help our nation limit carbon pollution and address climate change. It will allow us to surge forward with clean, renewable energy in ensuring healthier air today. The World Health Organization labeled climate change the worst health problem of this century. And very proud to say, the American Medical Association endorsed the Clean Power Plan as an important program to protect our health. Millions of people support the Clean Power Plan. And I'm excited to have it be brought in front of the court. It's on strong legal footing, and it's important for us and all of you here to educate people about this issue. An important one of those millions supporting the Clean Power Plan is Alejandro Stern, our next speaker, and she knows firsthand how air pollution and heat can be a deadly combination. Thank you.